Hello and welcome back to today's session, Farm Fundamentals. We have covered the ACH receptors. Now let's address the cleanup crew. The enzyme acetyl cholinesterase, that's ACHE. This enzyme is designed to rapidly break down ACH in the synapse, ensuring that the signal is brief and precise. So ACHE are drugs that block this cleanup crew, that is acetylcholinesterase inhibitors, ACHEI. So the result, ACH accumulates in the synapse, amplifying or prolonging the effects of ACH at all muscarinic and nicotinic receptors. This pharmacology is vital for both medicine and toxicology. In segment 1, we cover the reversible inhibitors, that's our therapeutic amplifiers. In segment 2, we cover our irreversible inhibitors or the organophosphate toxicity. And in our segment 3, we cover about the treatment of organophosphate poisoning. So let's start from our segment 1. Reversible inhibitors bind temporarily to ACHE enzyme, slowing the breakdown of ACH. Their effect is short-lived, allowing for therapeutic control. So these drugs mimic ACH and temporarily occupy the active site of ACHE. The enzyme eventually processes the inhibitor, freeing itself to continue its normal function. Examples are neostigmine and pyridostigmine. So they are highly polar, meaning they do not cross the blood-brain barrier. They act mainly on the peripheral NM receptors of the skeletal muscles and peripheral M receptors. So the next example is physostigmine. So it's non-polar, meaning it does cross the BBB. It affects both peripheral and central cholinergic systems. So clinical uses, they are used to treat myasthenia gravis. So it's the primary use. MG is an autoimmune disease where the body attacks NM receptors, causing profound muscle weakness. So pyridostigmine and neostigmine increase the amount of ACH at the NMG, temporarily overcoming the receptor deficit and improving muscle strength. And it's also used for the reversal of neuromuscular blockade. It's used in surgery to reverse the effect of non-depolarizing muscle relaxants like rocuronium. Neostigmine floods NMG with ACH, forcing the antagonist off the receptor. Alzheimer's disease. ACH signaling is crucial for memory and cognition. Donepezil, a different class of CHEI, is used to boost the ACH levels in brain to temporarily slow down cognitive decline. Atropine poisoning. Physostigmine can be used to reverse the peripheral and central effects of severe anticholinergic poisoning like an atropine overdose. Here in segment 2, we discuss our irreversible inhibitors. So irreversible inhibitors are the classic clinical toxicology scenario. These compounds can form an extremely stable permanent bond with ACHE enzyme. Irreversible inhibitors, primarily organophosphates, form a covalent bond with the enzyme. So this binding is followed by a process called aging, which makes the bond virtually unbreakable. The enzyme is destroyed permanently. The body must synthesize new ACHE to recover. Examples are pesticides like malathion and parathion. These are common insecticides, and nerve agents like sarin, tabune, and VX. So these are chemical warfare agents. Toxicity are cholinergic crisis. So OP poisoning results in a massive uncontrolled global activation of entire cholinergic system, a cholinergic crisis. Muscarinic effects, that is peripheral effects, excessive gland secretion, and smooth muscle contraction. The sludge symptoms we have discussed in the previous session on overdrive. Patients present with profuse salivation, lacrimation, vomiting, diarrhea, bronchoria, that is excess lung secretions, and severe bronchoconstriction. Death is often due to respiratory failure from bronchial fluid buildup and spasms. Nicotinic effects, peripheral ones. Overstimulation of NM receptors leads initially to muscle fasciculations, as in twitching, followed rapidly by profound muscle paralysis, including the diaphragm. CNS effects include confusion, seizures, and rapid respiratory depression. And segment 3, the treatment of organophosphate poisoning. The treatment for severe OP poisoning requires a rapid two-pronged pharmacological approach. Atropine, the antagonist, administered immediately and aggressively. Atropine is a muscarinic antagonist and is used to block the life-threatening muscarinic effects, bronchial secretions, and bradycardia. Crucially, atropine does not stop the paralysis. For the second line of defense, pralidoxime, PAM, the reactivator. So this drug is an ACHE reactivator. If administered before the enzyme aging process is complete within the first few hours, PAM can physically break the OP bond and restore the function of ACHE, reversing the paralysis. So, to conclude, cholinesterase inhibitors therefore serve two functions as carefully calibrated therapeutic looks like pyridostigmine for MG and as terrifying environmental toxins like organophosphates that overload the body's entire involuntary control system. We'll see you in another next interesting session. Until then, keep reading, highlighting, drawing, and revising.